start.
So we'll be learning hepatitis B serology, interpreting hepatitis B serology, very important for your exam. Okay,
Yes.
expect at least one question here and there on this. So before that, I want you to know these two screens. Can you see this?
Where?
There is a screen of hepatitis B. This is the hepatitis B virus. Okay. So inside you can see the core antigens. Okay.
Actually,
Inside are
I'm
the
not
core.
able to see any image or something. It's just past medicine.
Oh, just one second.
Yes,
Now,
now I'm able to.
so here you can see the hepatitis B virus. And we are going to see the antigens and antibody related to this.
Okay.
In the virus, you've got the surface antigen. Now, surface antigen, HBs antigen, the kit which we usually use. This antigen is expressed only when the patient is infected with hepatitis B. So, the first thing which the patient touches or the patient's blood touches is the surface of this virus, right?
Okay.
This is also given in the form of vaccine. Why? To produce the antibody response. Okay. So
Okay.
there will be two conditions in which the antigen will be the surface antigen. And on this, in a response to this antigen, we've got these antibodies. So for surface antigen, we've got surface antibody. That is the HBs antibody.
Yeah.
This is a response to HBs antigen. In your exam, they will either give HBs antigen positive or anti-HBs positive. Both
Okay.
of them mean the same thing. Okay? Both of them
Okay.
mean the same thing. Response to the HBs, that is vaccinated or infection. This is clear?
Yes.
Then we've got the E antigen, which is in the middle. Here you can see. Now, what does this antigen do? Whenever the virus starts replicating, this E antigen is released in the blood.
Okay.
What does it imply? That there is some infectivity is going on. Why? Because of replication. There is a replication going on. And when does the replication start? Immediately as soon as the hepatitis B virus enters the blood. So that
Okay.
also means that this virus, this phase is in acute phase. Okay.
Okay.
The reaction or the response to this E antigen will be releasing of E antibody by the body, by our body. So in the serum, you will see HBe antibody, which will be positive in the acute phase. And what does it imply? That the virus is replicating.
Replicating. Okay.
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 Then you've got the core antigen, which is in the center. Now remember one thing, very important, and this is very crucial. This antigen is not released in the serum. Our
Okay.
antibodies go and attack this core antibody. So that is why you do not get this in the blood. Okay. HBC
Okay.
antigen is not in the blood. Our antibodies are going to go and form IgM and IgG in response to the core antigen. Now, when does this core antibody form? There are two types. One, there is IgM, which is less than 6 months. IgM implies that is the virus is still in an acute phase. And IgG will imply that the virus is in chronic phase. Is this
Okay.
clear?
Yes. Okay.
Okay. So
Yes.
we are going to we can see HBs antigen, we can see anti-HBs antibody.
The body.
We can also see anti-HBe antibodies, and we will see anti-HBc antibodies, IgM or IgG. We are not going to see HBc antigen at all, or this
Okay.
antigen. Is this clear?
Yes, it is.
Then we've got, so initially what we do is screening of any hepatitis B patient. We check this. Usually we check the
Yes.
anti-HBc antigen. This implies active infection. If there is a core antibody, means there might be some previous infection. It might be IgM or IgG.
IgG.
If this is positive, then we'll do HBe antigen. This implies how infective or viral replication. Okay. HBV DNA, I'm not discussing here, but usually the next step after diagnosing hepatitis B will be checking how much is the HBV DNA, because it will
Copies of the DNA.
copies DNA, because more than 2000 copies if we have, we are going to treat that. Okay.
Quantitative. Yes.
Remember, HBs antigen used in vaccine and HBs antibody implies previous vaccination. Is
Vaccination.
this clear? Okay.
Yes.
S antigen in the vaccine, antibody previous vaccination. Matlab the body has reacted. So these specific wordings are important in your exam. Okay.
Okay.
Then,
Sure.
if you're talking in the past medicine, the notes which are given, surface antigen is the first marker to appear and causes the production of anti-HBs antibody,
Yes.
right? HBs
Yes.
antigen normally implies acute disease present for 1 to 6
1
months.
to 6 months.
If it is present for more than 6 months, this implies chronic disease.
Chronic disease.
Matlab, at first point, when we are checking the HBs antigen, we do not know whether this is acute or chronic. है ना?
Okay.
We
Yes.
need some baseline. We need a day one. Okay, day one. Some
Yeah.
January 1, we have checked HBs antigen, and after 6 months, that is in June, we are checking again, and it is still present. That then it will be defined. Then it will define that there is some chronicity,
Chronic.
right? So we need
Yes.
2 readings to define the chronicity of this. Is this clear?
Okay. Yes.
Then you've got anti-HBs implies immunity.
Okay.
Anti-HBC implies current infection or chronic. IgM is less than 6 months. IgG will be more than 6 months.
Okay.
HBE antigen results from breakdown of core antigen
Continue.
from infected liver cell, as is therefore a marker of infectivity.
Effectivity.
Okay? What are the
Okay.
examples? Now, if the patient has got previous immunization, then it denotes anti-HBs positive.
Yes.
Okay?
And all others are negative.
All others are negative. Okay. Now,
Yes.
this is anti-HBs positive, and sometimes they will also give HBs antigen positive. That means the patient has been vaccinated. So both
Okay.
of these imply the same thing.
Same thing.
In our mind, what happens when we are solving the questions and when we are initially solving serology questions, and this concept is not clear, we only rate that anti-HBs positive, all others negative. So we
Yes.
think HBs antigen also should be negative. No. Okay, both of them are
Yes.
same.
Same.
Is this clear? Then previous hepatitis B more than 6 months and the patient is not a carrier.
Okay.
If the patient is not a carrier, anti-HBC positive, IgG, okay, and HBs antigen negative, okay. Then previous hepatitis B infection is there, and now the patient is a carrier. That means HBs antigen is positive. That means carrier
And
means
HBsAg positive and anti-HBC positive.
yes. So carrier mein what should be positive?
HBsAg positive with anti-HBC positive.
Yes. Carrier needs to have this positive. Okay. With IgG,
Okay.
with core antibody. है ना? That is why
Okay.
we are telling that this patient is a carrier. नहीं तो why are we not telling कि this patient is a infection or acute infection or acute
Acute.
phase of, we are not all telling that. We're telling that the patient is carrier. Why? Because the
There is
infective
HBs surface antigen is positive with having the core antibody for
core
the.
antibody. Exactly. Carrier core antibody should be present. In your exam, along with this so you will tell okay, antigen infectivity is there, but core antibody also has to be present to call it as label it as
Carrier.
carrier. Is this clear?
Yes, ma'am. I do have a doubt. So, if HBsAg is positive and core antibody is positive, so it would be a carrier, or we can also conclude that it has a chronic. It is a chronic disease.
It is a chronic disease. This previous
Okay.
hepatitis B, it is a chronic disease. It is a chronic disease if the patient has got IgG.
G.
Okay, then this
Okay.
is a chronic one.
Okay.
Okay. Is this
Oh,
clear now?
yes.
Okay. So again, they're saying the same things. Now, what we'll do, we'll solve some MCQs related to this. We've got some AI questions which are specifically directed towards this. Okay, let's see how much we get from what we have studied. Whenever you're
Okay.
attempting the question, first read the last line. Sometimes this line is enough for you to answer the question. You don't need to need sometimes. There might be 3 out of 100 questions, but that
Okay.
time is also very precious in exam. Okay. So, what is the most appropriate interpretation of these
Interpretation of these
results?
results.
Then you read the options, just scan through them. So, they are asking you what type of infection it is. Then you go up. You can read the question now.
A 28-year-old woman attends the antenatal clinic for her booking appointment at 12 weeks gestation. She is originally from Ghana and moved to UK 5 years ago. She has no significant past medical history and takes no regular medication. As per part of her routine antenatal screening, hepatitis B serology is performed with the following results. So HBsAg is positive, so it means that surface antigen is positive and anti-HBs is negative. So it means that it is pointing towards acute infection till now, but
Hmm?
anti-HBC total is positive. So core anti-HBC is positive. Okay, so there is antibody against the core antigen,
Hmm.
and then anti-HBC IgM negative. Okay, so it is negative. IgM is negative, so it is going towards chronic. Okay,
Chronic.
anti HbAg negative. Okay, so it is negative. Anti HbE is positive. Okay, so HBV DNA is 800 international unit, and it should be less than 20. Okay, so what are the options? Acute, no, it's not acute. Chronic hepatitis B infectivity with high infectivity. The third option is chronic hepatitis B infection with low infectivity. Hepatitis B vaccination induced immunity resolved. So the answer is chronic hepatitis B infection with high infectivity, to my opinion.
Okay, let's see. So this is actually with low infectivity. I'll tell you why. Because of the
Okay.
DNA and the, one second, the HBS positive for more than 6 months, that you've got it. The negative HBe antigen and positive anti-HBe indicate what? A very important
Seroconversion.
concept of seroconversion. Okay?
Okay.
When HBe antigen is no more released in the blood, that means the virus is not going any more replication. And
Okay.
the presence of anti-HBe antibody in the blood indicates that the body has already overcome this infectivity and has produced a lot of antibody, and the body is now protected from replication. है ना?
Okay. Okay.
Which typically occurs after years of infection and suggests low viral replication and infectivity. This is supported by the relatively low HBV DNA. 800 is nothing. We don't treat patient at 800 DNA, right?
Okay.
Detectable is much lower than levels seen in highly infectious states.
Success states.
Raised to 8 रहता है in very
Okay.
infectious. So this pattern is consistent with inactive carriers
Carry.
or HBe antigen negative chronic hepatitis.
Hepatitis B.
Very difficult concept, but
Yeah.
you can simplify it. Once you understand this concept, everything dances in exam.
Yeah.
Okay? You'll pick up like anything. Okay? Now, why this is wrong? Chronic hepatitis B infection with high infectivity is characterized by a positive HBs antigen, okay,
Yes.
and a positive HBe antigen, okay.
Okay.
That means the
Okay.
virus is, the production line is very,
Production of the, yeah, replication is very high.
and in that there will be a negative anti-HBe. That means the body
Okay.
has not overcome the
Yeah,
infection.
there are no antibodies against the replication which is happening.
Exactly. So high HBV DNA, that also more than 20,000 international unit per ml. So in this case, while the patient has positive HBs antigen confirming chronic infection, the HB is negative and anti
Negative.
is positive. Okay,
Positive.
you got the concept. We'll see one more
Yeah.
question. What is the most likely interpretation? Again, they're asking you, and they're asking you the similar question. It is.
Okay, so a 32-year-old male health worker is undergoing routine occupational health screening before starting a new job. He is asymptomatic and reports no significant past medical history. He believes he was vaccinated against hepatitis B as a child but is unsure of his vaccination status. His laboratory results are as follows. So HBs AG is negative. So there is no infection as of now. Anti-HBs positive, 100 international unit per liter. Okay, so anti-HBs, so it means the antibodies antibody against HBs is positive. Anti-HBC IgG positive.
Hmm.
Okay, and anti-HBC IgM negative. Okay, so this guy is protected. So
Yes.
the answer should be immunity due to resolved past hepatitis B infection, immunity due to hepatitis B vaccination, chronic hepatitis B infection, acute hepatitis B infection, susceptible to hepatitis B infection. So we can easily rule out the last three options.
Okay.
And I think immunity due to resolved past hepatitis B infection. No, I think the answer is due to immunity due to hepatitis B vaccination.
Okay. In vaccination, we discussed that this problem. In vaccination, all others are negative. That means in the other, the core one also should be negative.
Okay.
No. So the
Yes.
core is positive. That means,
Okay. So if the core is positive, then it is going towards the chronic hepatitis B infection.
है ना?
Yes.
If immunity was there, this would have been negative.
Negative.
Immunity due to resolved past hepatitis B infection, no. In that also, you cannot tell. Okay, so this chronic infection, you were confused with this or this? No, no.
Yeah, I was confused between the second option and the third option.
You were actually correct in the first instant. Immunity due to resolved past hepatitis B
The
infection.
infection.
Okay. So the presence of anti-HBC IgG indicates that the patient has been previously
It's
infected.
infected with hepatitis B
Yes.
virus. Okay.
So that resolved I didn't see. Uh, Vaccination, it will not be. I did not see the infection part here. Sorry, my bad.
Okay.
I was focusing on the vaccination. So that's why I said ki this will not have core antibody. In
Okay.
chronic hepatitis B infection, this is characterized by presence of HBs antigen for more
For
than
more
6.
than 6 months.
I told you two readings are required to tell
Yeah.
the chronicity. And patients with chronic infection have positive HBs and positive anti-HBC IgG. However, patient's HBs antigen is negative. That means the
Yes.
patient is no more infected. ठीक है?
Okay.
Hmm. So in our mind, what happens? We think कि chronic है तो this infection means it is settled. But no, chronic infection is just telling you the timeline. That does not mean the infection is settled. HBs
Yeah.
antigen has to be present here.
Okay.
Which of the following is the most appropriate next step before initiating TNF alpha inhibitor?
Inhibitor therapy. Okay.
Any
So
idea?
okay. So TNF alpha. Yeah, I will. So a 42-year-old man with ankylosing spondylitis is being considered for treatment with serotolizumab pegol, a TNF-alpha inhibitor. He had inadequate response to NSAIDs and physiotherapy. His past medical history includes a treated pulmonary tuberculosis infection 5 years ago. His current medication include naproxen 500 mg twice daily and omeprazole 20 mg once daily. Which of the following is the most appropriate next step before initiating TNF-alpha inhibitor therapy? So there are two side effects of TNF-alpha inhibitor therapy is like reactivation of tuberculosis and reactivation of hepatitis B.
Hmm.
So, like in the past, patient was having tuberculosis. Then I think that we should first screen for again chest X-ray.
Okay. I'll tell you one thing. What will happen to a person who has resolved tuberculosis, suppose on 2020, and you check his chest X-ray after 3 years? Will it show any difference?
So, okay, on the chest X-ray, the lesions which have been occurred, they will be like that the whole life, I think.
है
So
ना?
they will mention,
So
yeah.
is it a good screening
So
test?
yeah,
I'll
so
just
chest
mark it
X-ray actually
before. Yeah, sorry, huh?
the answers okay.
That's right. So that you know, if I mark it wrong, you can revise it again. If I don't mark it, then you cannot revise it. That's the
Yeah.
thing. Uh, so it's a good, and I like your thinking that you this hepatitis B question uh, set, you thought of TB as the first thing, which is incredible. But chest X-ray of a TB patient who's resolved will be the same even if you see that X-ray 20 years, 30 years, because the fiber
Yeah.
which is occurred will be same, will be there. Okay? A better
Yeah.
test would be IGRA, not
Okay.
very famous in India, but very famous in UK. So
Yeah,
this
also
huh,
famous in the hospital we are working in. So like I have seen like
people
we do
doing it.
order it. Yeah.
IGRA a lot. So we
Yeah.
need it for no, we need for medical legal purpose in our hospital. But there, this is very it's the mainstay of uh, uh, investigation for tuberculosis. So this
Okay.
will actually tell you whether there is some reactivation which has occurred. So the baseline will be done by IGRA. Okay? Hepatitis B serology is a good test, but before starting, but it is not the most urgent concern in this patient.
Yeah, also I think that we should not be screened because if we are suspecting it would cause reactivation. So
Hmm.
I think that that is not useful to do in the first instance.
Actually, what happens in TNF alpha or any immunosuppressive therapy, you must have seen even in rituximab therapy, which we give. We usually check Hep B, HIV, and all that. So that is a baseline. But they
Yeah,
are,
okay.
and in your exam, I am not telling that all the options will be wrong. And that is
Yeah.
why this is such a difficult exam because both these options are correct. The baseline is needed for both of these. Okay, because hepatitis B serology, you never
Yeah,
know the
actually
patient is
this time
symptomatic.
they gave around three questions from hepatitis B serology.
Yes, it's very important. And they give all different difficult ones. They won't give easy ones.
Yeah.
Chalo, we'll solve one more question. What is the most appropriate interpretation of these results?
Okay. So, an asymptomatic 35-year-old man attends your clinic for a routine health assessment. He has no significant past medical history and is not on medications.
Hmm.
He mentions that he has not received any vaccinations recently. His blood test shows the following hepatitis B serology. Okay, so HBsAg positive, so it goes in the favor of acute infection.
Some infection.
Anti,
Hmm.
yeah, some infection is there. Anti-HBc IgM negative. Okay, so anti-HBc core is negative, but that is anti-HBc IgG positive. So it goes in favor of chronic. But we need to see if HBs AG is more than 6 months,
Hmm.
positive from since 6 months. So there is no mention of that.
But when IgG is positive, that implies
But
that it is.
IgG is positive, then we need to think about, yeah, it could be a chronic infection.
Hmm.
So what options we do have? He is immune due to previous vaccination. No. So because he is not vaccinated.
Hmm.
So these options get wrong. He is immune due to past infection. So no, he is not immune.
Good.
He is acutely infected with acutely no. So because IgG is positive, then it is not acutely infected. So we can also cut this off. He is chronically infected with hepatitis B. Yes, it goes with the answer to this
Yes.
question. But he has resolved a past infection and is no longer infected is also incorrect. So we should
Beautiful.
go, yeah. So we should go with the
Yeah.
this one, the fourth option. He is chronically infected with hepatitis B.
Exactly. So he is immune due to previous infection vaccination. This is not correct because core antibody is present. Okay.
No,
ठीक है.
also he is mentioned that he is not vaccinated against
Oh yeah.
recently.
That that will also go definitely. So very beautifully explained. Let's see if this is correct. See, got it correct.
Yeah.
ठीक. So this looks easy, but it's got a lot of concept
Yeah,
behind it.
it has a lot of technicality actually. So in sometimes actually when I was preparing for the exam, so I was also having getting incorrect
Yeah,
questions answers, but in the exam it was like I got all the three correct.
good.
So
That's great to see.
yeah,
Chalo. Chalo, I hope it helps you in your part
Yes.
exam preparation now, and all the best for your results. And thank you for this. Thank you.
Thank
Chalo.
you. You're welcome.
I'll